Good evening, esteemed members. Thank you all for joining today. If you can hear me, kindly let us know which branch of PSK you are joining us from. All right, thank you so much for the feedback. Good evening, Dr. Ajay Patel from Central Branch, Dr. Sorej from Nairobi, Dr. Aniz from Nairobi. Thank you so much for joining. All right, thank you for the feedback. Dr. Daniel Kariuki from Nairobi, Dr. Purity, Dr. Dorcas from Nakuru. Karibuni sana. Thank you. I see representation from all parts of Kenya. Dr. Perez from Nyanza, Dr. Winnie, Dr. Mark Omere from Western, Karibuni sana. From Kwale, Dr. Okeo, Karibu. Dr. Hanan Jerry from Kiambu, Karibu. Dr. Mageto from Kisii, welcome. All right, so I see it's 7:05. Once again, good evening and welcome to today's webinar. Thank you so much for creating time to join. And today's webinar is on mental health, self-care for the pharmacist. And this event is being sponsored by Troika. And later on, we'll be having Edward from Troika who will be speaking to us. Our speaker today is Dr. Catherine Gitau, who is a consultant psychiatrist at the Aga Khan University Hospital. She'll be covering the topic. So just before we get started, I'd like to remind all of us to subscribe to this event on the PPB portal. And all you have to do is go to the PPB portal under the CPD events section, search for mental health, and you should be able to see the title of this event, Mental Health, Self-Care for the Pharmacist. So ensure that you subscribe early and on time so that you'll be able to get your CPD points on time as well. Just a few ground rules and announcements before we start. And to remind you that you'll be muted during the entire course of this session. So if you have any questions, kindly utilize the Q&A tab at the bottom of your window, and all the questions will be responded to by the presenter at the end of the session. This session is being recorded and will be made available on PSK YouTube page. Just a brief on today's agenda. Our first presenter will be Dr. Catherine Gitau, and then later on from 7:50 to 8:10, we'll have Edward from Troika. Then we'll have the Q&A session from 8:10 to 8:20, then the closing remarks. So at this point, I'd like to welcome our speaker for today, Dr. Catherine. Dr. Catherine, if you can hear me, you could share your screen.
Yes, I can hear you. Thank you. Let me just share my screen. Okay. So thank you for inviting me to make this presentation. I would like to just start by a common phrase we use in the mental health field, that there's no health without mental health. So as a way of introduction, I just state the obvious, that I don't know why my slides are not moving. Maybe I start sharing again.
Maybe you could stop sharing and then share again.
Yeah. Yeah. So as a way of introduction, I'll just say that in the mental health profession, there's a lot of stress that we face. And over time, this stress can affect our mental health and lead to various conditions, most common being depression and anxiety, which eventually not only affect our work, but will affect our family, our social life, and many other aspects, including our physical health as well. So the purpose of this presentation, I would say, is to help us build our resilience. And when we say we want to build our resilience, is the ability to cope with the negative effects of stress, and so avoid mental health problems and their wider effects. So as healthcare providers, there are various strategies that can help us in building our resilience and our mental well-being. And self-care is just one aspect of it. And I'm glad today's topic is emphasizing that it is mental health self-care, because there are various aspects of self-care, which would also include financial, amongst others. So what is self-care? I don't know why I keep getting the same problem. Okay, it's moving now. Okay. All right. So self-care means taking time to do things that help you live well and improve both your physical and mental health. And it can in turn help you manage stress and lower the risks of illness, increase your energy, and even a small act of self-care in a day can really have a major impact. So we'll talk about different aspects of self-care, and we'll start first with relationships. Why relationships? Because it's been seen that people who work in the mental health field spend a lot of time at work or doing work-related things, and hence they end up being isolated and experiencing loneliness as a result of that, because even when you're at work, you're not really having time to relate with the people around you. You're mostly just focused on the duties that you need to do to perform. So as part of self-care, one of the questions I would ask is, number one, how do you relate with yourself? Do you know your strengths? Do you know your weaknesses? Do you talk to yourself positively and you talk positively with others? Do you spend time with, friends, with family? Do you prioritize that? And I suppose then when you know what your strengths, what your weaknesses are, do you actually spend time to work on either improving your strengths and maybe working on the weaknesses? So, because this in turn will affect how you relate with others. How you relate with yourself is really key. And I think we should prioritize that. And as we go along, we'll also look at self-awareness in the sense that, do you know your personality type? Have you, and if you do, again, how does that help you relate better with others and also with yourself? So here is to emphasize the need for being connected with others, and that sense of connectedness will boost your well-being. So I don't know how often you've spent time with your loved ones in the last 1 month, in the last year. You should prioritize that as part of your self-care. Then another thing that, of course, as medics can be difficult to do is to rest and get adequate rest. So to help us in this area, are you able to stick to a sleep schedule? Do you have a sleep schedule? Do you feel like sleep is a priority for you? Because then is it work, and less sleep, or reading? Because again, we want to further our studies and do all these other important things. And does that rob you of your rest? Are we able to reduce on the blue light in the evening? That again, we find from various studies we've seen insomnia is quite common amongst the medical health professionals. So do you take time to seek help when you notice that you're not being able to sleep well? Then do you take micro breaks during the day as you're working, or is it just work, work, work? As we say, things always work better when they're after they have been unplugged. So do you unplug even during the day, when even if you're having a hectic day, to just take a few moments to take care of yourself? When I joined the mental health field, I think that's where I learned to take a break when it's time to, when it's lunch break. I'll actually take a few minutes break. When it's tea break, I'll take a few minutes break. But prior to that, as a health professional as well, it was just work, 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 work until you're really exhausted. So are you taking time to take those breaks in your day? And are you able to recognize when you're tired or fatigued and actually take maybe some time away from work? And again, for most people, they may take a leave, but even when they take their leave, they're still, doing a locum or something like that. So when you do take your breaks, can you use that as time to actually rest? So rest is very important in as far as your self-care is concerned, and helping you with your mental health and resilience. How often do you exercise? Are you able to take 30 minutes of exercise in a day? We are told even something as simple as walking for 30 minutes in a day can boost your mood. And if you can even walk with a partner or somebody, a colleague, then that in itself is a mood booster. So can we set aside time to exercise at least 5 times in a week? And it's always better if you choose an exercise that you will enjoy, so that then it doesn't look like work again. And if you're not able to do the 30 minutes, can you do 10 minutes? If you work in a place where there's a staircase, can you take the staircase at work? Or, even if it's at home, are you even able to just walk around the hospital or the compound where you work for about 10 minutes and come back and continue with your work? So exercise is something we can also learn to incorporate into our day. And that again will help us release the feel-good hormones and help us reduce our stress levels, and eventually help us become more resilient. Then, do you take time for vacations when you're on your leaves? Vacations are good because the actual planning of it can boost your mood. The memories of the vacation also boost your mood. The time away from your usual routines is also really important for you. So time away from situations we associate with stress will improve your mood and allow you to relax and connect with people and activities that are important to you. And this gives your brain time to reset. So I'm not really getting into the science of this, but just for us to evaluate in terms of what do we prioritize. These are some of the things that also should be part of what you plan in a year, to at least have one vacation. Or it doesn't have to be an expensive one. We don't have to, go to a very expensive place. It can be a simple, not too far away, and something not too expensive again, so that you don't get financially strained. But it is possible to take a break and take a holiday. And the planning of it and all that we've seen are all ways to boost our mood. Then I don't know how many of us practice our hobbies now. If I was to ask, like a show of hands, how many of us still have hobbies that we enjoy and we still practice? I know with time, as we get busy with life, then we are more likely to let go of our hobbies and fun activities, and maybe narrow down to meeting friends once in a while. So it's important to find a hobby, or rather to remind yourself of the hobbies that you enjoyed previously. If you want to create new ones, all the same, it's good, because these are going to be mood boosters, and they also reduce your stress. They help you rediscover your strengths. For some, their hobbies can also be a source of income. Again, not to now focus on it being work, 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 but can it be something that you use to relax? Then it can also be an activity that will help you have social connections. As we said, the connectedness with other people is very important. Then if it is something like exercise, which is part of your hobbies, then it can help improve your sleep as well. And it gives you a sense of accomplishment when you're able to see a few things that you can do and you're good at aside from work. So it would be important for us to again remind ourselves what are those recreational activities we can participate in at least once a week. And it also gives you something to look forward to at the end of the day, if you're practicing it daily, or at the end of the week. So that in itself will boost your mood. It will also boost your self-confidence as you get better and better at it. And at the same time, improving your optimism. So all these are good in terms of improving your general well-being. Now, another aspect of self-care is practicing mindfulness and meditation. Not many people are fond of meditation, but it's a good exercise which you can get to practice. And once you learn to practice it, it's like it trains your brain. It trains your brain to be present in every moment. So it disciplines your mind, and you become more aware of negative thoughts, that which we usually refer to them as automatic negative thoughts, that are very common, especially when you're going through stressful events. So when you're talking about mindfulness, we are saying that you're present in the moment. And mindfulness is something that you can practice on a day-to-day basis with any activity. It can be as simple as maybe taking your cup of coffee in the morning. Are you actually enjoying that cup of coffee? Are you tasting what is in your cup of coffee? Or you're just drinking it to get the energy and rush out of the house and, get on with your business? So can we learn to take time to actually enjoy that cup of coffee, that cup of tea? When you're listening to your friends or your colleagues, do you actually listen, or you're just processing a response without listening? When you take a walk, maybe if you like taking walks, are you mindful of what is around you, the sensations in your body. What are you feeling at that time? Can you feel, what are your feet feeling? Just focusing on your senses as you actually do various activities. Another way of practicing mindfulness, and especially when you're feeling very stressed out, maybe overwhelmed, is to take a tour of your five senses. And what does that mean? It is noticing and mentally naming if it is five things you see, four things you feel, three things you can hear, two things you can smell, and one thing you can taste. So you can use any approach. It can be five things you can hear, four things you can taste, or it can take any you can choose any way to start and go around this, but just using your five senses to help you ground yourself. We call it grounding techniques. And this can help, if you're feeling overwhelmed, can help you relax and stop your mind from wandering too much. Then another way of maybe calming yourself down when you're feeling overwhelmed, and is also a way of practicing mindfulness, is to take deep breaths in and out. I know if I asked you to take a deep, there's what we call deep breathing exercises. Um, some people, if we ask each person to demonstrate how you'd do your deep breathing exercises, it would probably be very different from for each person. But ideally, it's taking a slow, deep breath in, as if you were blowing a balloon in your stomach without your shoulders moving up, and you just calm, but there's an expansion because your lungs are being inflated fully. The inflation is seen in your stomach. So taking a deep breath in slowly to a count of three and holding for even a count of three, and then slowly exhaling out. There are some videos that are in YouTube which you can use to um, practice this. It's not a very simple exercise to do, but it is very helpful once you get used to it. Sometimes you can do it wrong and the effects are the opposite. Instead of calming down, then you might feel more anxious. So it's good to get it right so that then you're able to do it well. And it has the effect that you'd want. So as you do this breathing exercise, at the same time, can you, speak to your mind and tell your mind to calm down? So you can just be, maybe as you breathe in, you say calm. As you breathe out, you're saying down, or you can just say it in your mind as you're breathing. So these are simple ways that you can help yourself get grounded and calm down when you're feeling overwhelmed. Practicing meditation, if you're able to do it on a daily basis, it really helps your mind stay focused and present. Then if you again like motivational phrases, then you can also speak those to yourself, meditate on them, or just keep repeating them in your mind. And that can also be helpful in terms of calming yourself down. Now, there are times when we go through difficult and stressful events, and we don't give ourselves enough time to process the emotions. And there are various ways that you can process this. Unfortunately, this is not like a class setup where you can ask questions and ask you who does what, and but for some people, journaling helps, where you're writing down your thoughts. Maybe it's an event that occurred and you experience certain thoughts, and these thoughts led you to feel a certain way. And because of that feeling, then you behaved a certain way. So journaling can help you in terms of processing emotions. Ladies are good at calling friends and talking through things. Even men, I see they call their friends, they talk. Some people will cry out some difficult, when they're having a difficult situation, they'll cry. Others will use art as a way of processing their emotions. So the emphasis here is when you're going through a stressful situation, don't just block it out of your mind. Try and process it sooner than later. And there are various ways that you can use to process that, as I've shown. Now, another thing is, again, as far as the stressful events are concerned, is when we have a problem at hand. Again, for some people, they would rather just shelf it and forget it. But it's always good to have this problem-solving approach where you define what the problem is. And when you're able to define what the problem actually is, then you're able to understand the problem better and make decisions to tackle the issue. For example, let's just talk about during COVID. It was common, people lost jobs, yeah? So if you lost a job, then that is a problem. But is it just the job, the loss of the job that's a problem, or there are other underlying issues? Because with the loss of a job, there's loss of a routine, there's loss of an income. And so when you analyze the problem to detail, then you're able to resolve each issue at a time. So if it is the issue of income, what other sources of income can you explore? If it is a question of routine, what other routines can you come up with that will, you know, help you occupy your time more productively? So problem-solving approach for each situation that comes along is important, because then you don't stay with a conflict at the back of your mind for too long, which then is a source of stress for you. So as problems arise, try and tackle them as soon as you can. Research all available options that you have and take action sooner than later. For the problem solving, again, there's what we call a worry window. A worry window is just generally time you allocate yourself in a day to actually resolve some stressful issues that you have not been able to tackle over some time. There are people who worry a lot. So those things that you're worrying a lot about, can you say maybe every morning at 7 a.m., I'll sit down, I will write these things I'm worrying about, find out what the problem actually is, and then try and come up with solutions for these problems. Especially for those people who have anxiety, worrying can really take a toll on you. So it's always good to use this approach of problem solving so that then the worries don't become too excessive, and anxiety then builds if you don't resolve them. So, and of course, as you come up with solutions, and it's good to monitor and evaluate if they're actually effective. Now, another important factor is nutrition, which is really necessary for our own well-being. Your brain is constantly working and needs fuel, and therefore you need a well-balanced meal. And as I had mentioned earlier, it's good to take time off from work, and here is where the nutrition comes in, so that you're then able to eat a balanced meal when it's time to eat. Because then what happens if you don't eat at the right time, you'll probably end up buying a snack or eating some junk, which at the end of the day has negative effects on your brain as well, and which will now increase inflammation and stress in your body. So can we, as your day starts, can you routinely plan that this is my time to eat, and I will actually have something, carry some food to work, I don't know, whatever can help you ensure that you're getting a well-balanced meal is important. And if you can also share a meal with a loved one, which will also, again, boost your mood, yeah? Then there's something called practicing gratitude, where we're saying it's important to every day to identify at least 5 things that were good for you. And these 5 things I usually emphasize are not just the common things. Sometimes you can just say, I'm grateful, I'm alive, I'm grateful, I have a job. Those are okay, yeah? But can you actually look out for the good things that are happening in the day? What happens to our mind is we are so used to, dealing with stress that most of the time we'll only focus on the negative things that have happened in a day. So are we able to capture at least 5 things every day that are good? For example, as probably you went to work, maybe someone was very kind, said, told you, gave you a good compliment. That's something to be grateful for. Maybe you had a good uh, you had a patient who complimented you or was very grateful for the work you're doing. You see, so you keep trying to identify as many good things that are happening in the day, and this sets your mind in a positive note. If you're telling yourself every day before I go to bed, I'm going to write 5 things I'm grateful for, then you will always be looking out for positive things. That again will reduce your stress level, will reduce your anxiety, and it will help you to be, to celebrate even the small victories that you're having in the day. So writing, you can either write it down or say it out loud, whichever you prefer, but I usually say 3 to 5 things. Try and mention them to yourself or to somebody else, or to write them down. Another way of taking care of ourselves is setting goals. And this goal setting can be in various areas of our lives. It can be financial, career, family, spiritual, hobbies. For those who like maybe mountain climbing, which other mountain are you climbing next? Which marathon are you attending the next time? So that, when you have the goals help align your focus and provide a sense of self-mastery. And this in itself can help you overlook some of the stresses that we face on a day-to-day basis, or even those stresses that we face on a day-to-day basis are more bearable. I'll give an example of somebody who runs the marathon quite a lot, and somebody asked them, how are you able to run, 42 kilometers? And, it's quite a long distance and you still finish strong. So for them, they say that the reason they're able to run the marathon is because they're thinking about the finish line. So they have their goal, they're looking at where they will end up. So when you focus on the goal, the things or the events that are happening before you achieve your goal, you may be willing to persevere them more as you look forward to achieving that which you desire. So there's this thing of doing, it's called a vision board. I don't know how many of you have those. Do you have them written out somewhere? That I would want to achieve this by this time, this and that and that. And that keeps you motivated. And you're also able to look at and acknowledge your progress and your achievements with time. And that also is part of self-care. Then another aspect of self-care is where we set healthy boundaries. And this helps you have autonomy and independence, and helps you conserve emotional energy. Where we're saying, you have your personal time. For example, if you have set a certain time for your exercise, everyone knows that that is your time for exercising. If you have set time for doing 1, 2, 3, it's obvious and everyone will know that this is the time this person does 1, 2, 3, so we leave that time to them. Another aspect of setting boundaries is, your values and sticking to them. Learning to say no. No can be a difficult word to say, but when you see that it's going to interfere with your personal time, then are you able to tell people, no, I'm not available to do this, I'm not able to do that. And we usually say that no is a complete answer in itself. You don't have to give the details, but just sticking to what you feel is within your limits. Then name your limits and be consistent with the boundaries you set. And usually it's best to communicate your boundaries by using I statements. That way then it's polite, I think. Yeah. And letting other people know when they cross your boundaries is also important. Yeah. Okay. Then spending time in nature, we say nature is therapeutic, and is, and appreciating what is happening. As we said, we practice mindfulness when we are out in nature, when we are walking, when we are hiking, having plants within the office. Nature, there's what we call nature-based interventions. We're saying that the more you see green things, it's like it releases feel-good hormones in you. So yeah, nature therapy is important. When you talk about self-awareness, we are asking again, I think I mentioned it briefly at the beginning. Do you know yourself well? Are you aware of what you feel at any given time and why you're feeling that way? Do you understand the links between your emotions, your thoughts, and your actions? And do you have your personal values which you uphold no matter what? Your personality type. There's a 16 personality type which is available online, and it's usually free. Are you able to look at, evaluate yourself, see what personality type you are, so that way then you understand what your strengths, what your weaknesses are, and it also helps you also understand maybe why you do things a certain way. And then there are things that you need to change. Will you be able to change them by yourself? Or would you need a professional to help you change? All those aspects of understanding yourself and your personality are important, and also a way of taking care of yourself. So self-awareness is vital for your interactions as well as your personal health. So if you have poor interactions, of course, that will have a negative impact on you psychologically and even on your health. So let's be self-aware. Take up courses where we are learning emotional intelligence, how you also manage your own stress. All those are ways of self-awareness and being able to deal with things as soon as they come up. Spiritual practices also important part of self-care, where we're saying for those who are spiritual, prayer, fasting, fellowship, all that helps you have a sense of connection, not only with people, but also with your God as you know Him. And it's also important. Now, to be able to implement this, if it is not something you routinely do, it's important to have an accountability partner. There's this form that was created to help, which you can share with a friend or your accountability partner. And then you're able to monitor, am I actually taking care of myself? And with time, the more you analyze it, then I think as everything that is evaluated, I think will improve over time. You're able to evaluate how you're doing and then make decisions on what needs to change, where you need more help. And this form has various aspects where we are looking at a sleep routine. What time have you set to be waking up, to be sleeping? Are you staying connected with friends, with family? Are you meeting up with them? Number 3 looks at hobbies. Which hobbies have you opted to be practicing? Are you practicing them on a regular basis? There was what we talked about, the worry window. This is number 4, or problem-solving time. Are you able to spend time with that, doing that, and that you're able to monitor your progress, your well-being practices, there's spirituality, there's exercise, gratitude journal. Are you being able to accomplish anything in this area? Charity is also a good way of also taking care of yourself, because as you give to others, you know, the joy in giving also has a positive impact on you. And this is, when we're saying charity, we're saying that you're doing good to others without expecting anything in return. Then nutrition, and then down here, drinking plenty of fresh water, avoiding sugary drinks, alcohol, and all that. Yeah. So this is a form you can share with somebody you wish to be your accountability partner as you start the self-care process. And that makes it easier for it to become a habit and something that you practice on a regular basis. Now, if you're not able to practice self-care and you feel that your mental health is not okay, then there's an option of seeking professional help. And for the professionals who deal in mental health, we have different cadres. The counselors have, there are those who are at certificate level, there are those who have diplomas. So those are the ones I'm calling counselors. Psychologists at degree level. And this category of counselors and psychologists mostly deal with talk therapy, where you're mostly analyzing your thinking patterns and why you reason a certain way, how you can deal with some of the problems that you're having. That is coping mechanisms, exploring what coping mechanisms can help you and such. Now, for psychiatrists, then for us, we mostly will be treating conditions such as now depression, anxiety, and all these other mental illnesses that come up as a result of maybe stress that has not been well managed. Then symptoms that indicate you need professional help are many, but the most common and the first symptoms that you'll see initially when the problem arises include difficulty sleeping, changes in your appetite, and most of the time it's just good to note mental health conditions have like a group of symptoms happening at the same time. So it will probably be difficulty sleeping, mood changes, appetite changes, finding that your mornings have become very slow because your motivation is quite low, difficulty concentrating, and finding that maybe mentally you're slowing down, lots of interest in things that you would usually find enjoyable, and inability to perform your daily functions and responsibilities. At this point, then it would indicate that you do need some professional help. I've not even mentioned hallucinations and anxiety and all these other things. But yeah, so if you're doing well and you're experiencing mental well-being and you have been able to practice self-care, we'd expect then that you're in a state of mental well-being where you have self-acceptance, a sense of self as part of something greater, a sense of self as independent rather than dependent on others for identity or happiness. And you know and use your unique character strengths. That's why we're talking about knowing your personality, your strengths, your weaknesses. Then you have an accurate perception of reality, knowing, again, and a common thing that people suffer from is, the tendency to think that they can mind read. So knowing that you can't mind read and other people's thoughts aren't always true, Then you have a desire for continued growth and you thrive in the face of adversity. You have and pursue interests. You know and remain true to values. You maintain emotionally healthy relationships. You can see that one is highlighted. I know many people talk about being in toxic relationships. Healthy relationships are really important when you're also taking care of yourself. Yeah. Then you find that when you have mental well-being, then you're optimistic, and yeah, you have determination and you're action oriented. So you want to get things going, and the motivation and drive to do and get things done is always there. So I think, I don't know how many minutes I have to, yeah, I'm done. I have 2 minutes to 7:50. I'll stop there. Thank you.
All right. Thank you so much, Dr. Catherine, for that presentation. I believe we've all learned a thing or two on how to better our mental health. So just a reminder, if you've not sent the questions, kindly do so. Use the Q&A tab to send in your questions. So at this point, we're going to have a presentation from the sponsor of the day, Troika. And we have a representative, Edward Mangare, who is going to present on behalf of Troika. Edward, if you can hear me. So as we wait for Edward, also, if you've not subscribed on the PPB portal, kindly do so. Take just a few minutes of your time today and subscribe to the event. The CPD points will be sent to the email that you registered with. So ensure you subscribe so that we can have enough tokens and share with everyone who's attended. Edward, can you hear me? Okay, so as we wait for Edward, maybe we can just start with a couple of questions that have come in. And the first one is from Dr. Wata, who's asking if in case you want to discuss your problems with anyone, would it have to be a psychiatrist? So maybe Dr. Catherine, you could start with that. And also for those who sorry, just a moment. For those who are sharing their email addresses on the chat, you don't have to send it on the chat. All the CPDs will be sent to the email that you registered with. So no need of sending your email on the chat. All right, Dr. Catherine, can you go on?
Thank you. So when it comes to discussing problems, you can start with the psychologist or the psychiatrist, and then we are able to analyze and see, is there something, if these problems have led to a change in your mental health, to what extent have they affected your mental health? Then if you need further treatment, then if it's a psychologist who saw you first, they can also refer you to the psychiatrist. If it's a psychiatrist who saw you first, then they can refer you to a psychologist. So whoever is closer to you and more available, just start there. Then we both would be of help.
Thank you so much. I will have the next question, which is from Dr. Sorej, who's actually commenting that pharmacists work for long hours, and in some cases, pharmacists are expected to work 12 hours a day, and then they have to find time to do maybe courses and all that. So it's very unreasonable, and a very unreasonable scenario for young mothers especially. So I don't know if you have any comment on that, considering, pharmacists are expected to work for 12 hours, especially in the community space. And then that means they also have to make time for other things. Do you have a comment for that?
Yes, I would just comment and say that if you did something small each day, when I talked about all these self-care techniques, I'm not saying that you'll implement everything at a go. You can implement one thing that you feel, this can actually work out in my current routine, and try and implement it. As I said, if it's something like exercise, even if you did 10 minutes, in the morning, 10 minutes later in the day, you still get some exercise done. Or if you opted to walk to work as opposed to driving to work, that way then you're also putting in some exercise. So it's just trying to see what you can incorporate in your day as reasonably as possible. Yeah. Maybe I'll stop that there. Yeah.
All right, thank you so much. We'll have Edward come in now, and then we'll continue with the Q&A. So for participants, kindly just keep bringing in your questions. They'll be responded to after this. So Edward, you can try sharing your screen.
Hello,
Hello, yes.
you can hear me now.
Yes, I can hear you.
I think you had not allowed me to unmute. And are you able to see my screen?
Yeah, we can see. Maybe you can just slides.
Now I'll just put the slides.
Okay.
Let me just put on the slides.
All right.
Are you able to see that?
Not yet. I think it should be loading.
Yeah, I think so. Just a minute, then it should be loading. But you can hear me clearly, right?
Loud and clear.
So it's okay. Are you able to see now?
Not yet.
I think then there is an issue. Anyway, I think we can just go on. My name is Edward. I work for Troika Pharma. As Troika, we are into pain management and anesthesia. We have very innovative brands. I think most of you must have come across most of our product. Just to highlight some of the product we have as Troika. We are in pain management. We have a series of innovative products. One of it is Dynapa QPS. Dynapa QPS is a topical preparation for diclofenac, which is one of the most diclofenac with the highest superior penetration. Apart from that, we have other products which include Zyka Extend. Zyka Extend is paracetamol extended release. It's the only paracetamol currently that can be given as a BD dose. So it's 375 mg and 675 mg extended release. Then we have the Dynapa range, that is Dynapa injection, Dynapa Plus, which is the tablet, and we have TESS, which is triamcinolone acetonide. We also have diltiazem, In fact, we are the only innovator with diltiazem organogel. You remember when it comes to unofficial treatment, sometimes nifedipine is being crushed and used for unofficial treatment. So Striker, we have diltiazem, which is an organogel, and it is very good, which you can keep at room temperature and still use. So Dynapa diltiazem is currently available in most of the hospitals. It can be used, and you can just keep it at room temperature. Apart from that, in anesthesia, we have a full range of anesthetic agents, starting from the gas. Most of you in the places you're working, I think you must have heard that halothane is being fetched away out of the market. So people are moving to sevoflurane as the gas. So as a company, what we are doing is that we are giving sevoflurane vaporizers, donating to all the institutions free of cost, because the cost is very expensive. So it's around 350,000. So as a company, we are giving the vaporizers free of cost. So anyone who would wish, if you don't find halothane, you can just contact us. We will be able to give you free vaporizers. Isoflurane is still there. We have Troipofol by brand name, Midazolam, Ketamine, and Fentanyl. That is in the anesthesia section. Currently, we launched vitamin B12, which is the first world nasal spray for vitamin B12. It is much better than the injections and much better than the tablets. So it's a nasal spray. It's called Nasal B12. It is the first world methylcobalamin nasal spray. So anyone who requires that, you can always come to us, and we will be give you all these products. I think in all the sections, apart from pain management, Dynapa, which is known, this is also another new segment we have of vitamin. That is, we have vitamin B12 nasal spray. We have the tablet sustained release vitamin B12, 1500 mcg. And now we are the only company again with Citrus SR, that is vitamin C sustained release. So that is our segment. And anyone who requires anything can easily talk to us. So I would try to answer a few questions, because I think I'm done. I can see a few questions. Maybe you can read them out, then I can answer.
Okay, so I see we have two so far. One is from, actually it's just one. We have Dr. Kelvin who's saying he's interested in the vaporizer. So I think maybe we could share your contact when we'll be sending out the recording for this session. From Dr. Eunice Karaoke, what is the frequency of administration of the B12 nasal spray?
So when it comes to nasal B12, there are two modes of administration. The first is in case where, because when we're having nasal B12, why we brought this is because you realize that absorption of vitamin B12 is an issue because of the intrinsic factor carrier. So some patients do not absorb vitamin B12. So in cases where there is deficiency, someone just need to use 7 doses. And when someone is using 7 doses, he uses in 14 days. That is in case of deficiency, when B12 level is below 150 picogram per ml. So in this case, someone is going to use just 7 doses in 14 days. That means alternate days, in one nostril and in another as a single dose. So 7 doses in 14 days. Now, in case of supplementation, where the patient B12 levels are not down, either the patient is on metformin for long term, or the patient is on PPI for long term, or the patient has been using injection. In this case, you only need to use weekly dosing. So in a month, you just need 4 doses in a month. So that's a weekly dosing for supplementation, for maintenance. But when it comes to deficiency, you have to use 7 doses in 14 days as a start dose. Then you go for maintenance, of course, weekly.
All right, thanks for that. I don't see any other. Okay, yeah, there's a question here from Eunice again, who's asking how many doses are in the spray?
Okay, one, it has around 22 doses. So if you're using for maintenance, just normal maintenance, then it can go up to 3 months. That is on weekly basis. But when you are using for deficiency, that means 7 doses in 14 days, then you are going for maintenance. That will last for roughly 2 months. So the doses are around 22.
All right, thanks so much. Just trying to see if there's any other question.
I think the cost, I've seen another question of the cost. Now, one bottle, the average cost is around between, now it all depends, but we can give it between 1,500 shillings to 1,800 shillings, one bottle. And our distributor is Harlis. Harlis is our distributor, but at the same time, if you need it directly in any place, we can courier it. I need to just share my number, which if I'm allowed, I can share here, which is 07. My mobile number is 07, then 26, 0726, 841, 941, 0726, 841, 941. If you require a vaporizer for Sevo any place, I can just also place it. You just need to get my number as 0726, 841, and 941.
All right, thank you so much, Edward, and also for supporting this session. So I've also, for colleagues, we've shared the email address on the chat. If you need to reach out to him, you can just do that. All right, thank you so much.
Just to finish, there's someone who has asked, it is methylcobalamin and not cyanocobalamin. So ours is methylcobalamin, not cyanocobalamin. And the strength of the B12 spray, each actuation, that means one, gives you 250 mcg, 250 mcg. So if you're giving 2, that is 500. That is the strength. Each actuation, like a single actuation. But while giving, you have to give 2 actuation. Means in one nostril and another nostril. So 250, 250, 500 mcg.
Maybe you could just answer the last one. What's the appropriate mode of administration for Dynapar? And the other one is how much is sevoflurane?
Okay. And now, when it comes to Dynapar injection, this is the only diclofenac injection that has been approved globally as IV bolus and also intradeltoid and also intragluteal. So you can give us IM and IV. While giving IV bolus, it should be a slow push. Any person who needs us to come to the hospital and do a workshop of Dynapar injection, we will come and do. And today, Dynapar injection is the only diclofenac injection that has been approved by meds. Initially, there were little politics of diclofenac injection, but I'm happy that now the politics are gone. It is available. So you can give us IV bolus, intradeltoid because it's 1 ml, and also IM intragluteal, or also IV infusion. You can choose any. Now, the cost of sevoflurane in the market currently is around 27,000. But as a company, what we are doing is we are giving at the lowest possible cost, around 20,000, even despite giving the vaporizers. If you go to some of our competitor, they're giving it around 28, 27, so forth, so forth. But despite giving the vaporizer, we are giving at the lowest cost possible.
All right, thank you so much, Edward. I think we've covered all the questions. If there's anything, we'll definitely let you know. And
thank you so much, Doc,
for support.
Okay.
All right, so we'll get back to the pending questions we have for Dr. Catherine, and I see we have more questions. So we'll start with a question from Dr. Nilesh, who says, I believe there are many people who are in due to work-related stress. Is there help for this?
I didn't get the question very well. I don't know if it's my network. Yes?
Can you hear me clearly?
Now I can, yes.
Okay. So the question is from Dr. Nilesh, who's saying, I believe many of us may be suffering from insomnia due to work-related stress. Is there any help for this?
Okay. For insomnia, there's different techniques that work. One of the best and natural one is exercise. I still keep insisting on exercise. But then supplements also can be helpful, like melatonin. But if you feel that the problem is still very persistent, I would encourage you to see a mental health professional, because then there might be something else that we need to deal with. Yeah. As opposed to self-medicating. I know doctors are very good at self-medicating. I don't know about pharmacists. Because then it would be good to find out, is there anything else underlying? Has a stress led to now depression, anxiety, and all that? Then we can manage that, and then you're able to sleep better.
All right, thank you for that. There's a question from Dr. George, who's asking, he's given a case situation where you walk away from your family. One child is sick, the other child is in high school, being sent home. The supervisor has declined to approve an off for you. So how do you cope with a situation like this?
Okay, that sounds like a difficult situation to be in. And here now comes in the issue of connectedness. If you have some sense of you have some good family friends or siblings, somebody you can delegate this to, then it would be helpful. And then also now going back to the workplace, there's what with the guidelines that have come up on mental health at the workplace. And it would be good for us now, as the people working in those areas, to emphasize on the need for good mental health. And, having, I'm not sure about the public sector and the HR system, but, the admins also having to look at what would be the best way of helping people at least have better mental health at the workplace. And denying somebody a leave to go and take care of a sick child, that doesn't sound like a good way to do that. So again, emphasizing and urging our, administrators, the HR, to look out also for our mental health, I think is important. So if you're able to delegate, it's okay. And maybe just take a leave. I don't know how else to advise on this, but delegation can be helpful, and also just agitating for better mental health at the workplace. I think that's our response to that one.
All right, thank you so much. There's a question from Dr. Anita, who's asking, what strategies can a leader implement to support their team members' mental health in a very busy working space and inadequate staffing?
Again, that sounds like, there's some sense of, what do I say, heavy workload. And those are definitely some of the things that would negatively affect your mental health. So is it possible to distribute some of this work in a sense that somebody is able to cope better? Because then if we are always maybe on firefighting mode, then it will be difficult for anyone to cope under such pressure. Encouraging them to, again, practice as much self-care as they can possibly do would be helpful. but just distributing the workload evenly so that it's not too overwhelming for that individual, I feel would be better. Time management techniques and avoiding last minute pressure and ensuring things are well outlined right from maybe at the beginning of the year, you already know what your targets are and you're able to work on those gradually without too much pressure. And then just finding other people to work. I don't know. And reducing the workload is necessary.
All right, thank
I'm
you.
done.
Thank you so much for that feedback. Just trying to see if there's any other question that you can respond to. So there's one, there's someone asking, how will you cope with an issue where you face rejection to a point that you end up fearing making friends? How will you deal with situations where you have a toxic work environment and the same situation at home? What's the best take here? So maybe you could address the two situations.
Okay. For the difficulty with toxic, with rejection, I would say it would be good to visit a psychologist and have some talk therapy, yeah? So that you're able to process some of these things. There are some situations we say could cause psychological trauma, and hence you feel like you're going to keep reliving the same situation in other relationships, which might not necessarily be true. But it would be good to process this through therapy and yeah, so that you know, that feeling of maybe the other relationships will be the same is dealt with. When you're dealing with toxic relationships at work, at home, then we usually say if you cannot change the situation, then you need to change how you're looking at the situation. And again, this would be something that you can be equipped with coping mechanisms, and you can explore different coping mechanisms in therapy. I would really advocate for therapy in this case. Yeah.
All right. See, we're already at 8:15. We'll just take one more question, and then you could give us just a parting shot. So there's someone asking, how do you recommend intake of supplements for mental health?
Now, it really depends on what condition you're treating, you know? Because some people may present with depression and their vitamin D levels are low, that supplement is okay. But using supplements per se to treat mental health conditions, I don't think is sufficient, because then again, we don't know what dosages, what are we targeting with the supplements. I would advise maybe see a mental health specialist. Let's see what we are dealing with. If it's something that does require supplements, then we'd go that way. But I would not say that supplements are the mainstay treatment for mental health conditions. Because again, with mental illnesses, there's a wide range of that, and how to target the condition you're dealing with, you need an assessment first.
All right, thank you. And maybe just as you give us your parting shot, you could just address one of the questions that we've also received here on something to do with overdependence. Let's say, for example, where you're the firstborn and most people are depending on you, and you become stagnant in your personal growth. So, like, how do you manage that? So maybe as you respond to that, you can give us your parting shot.
Okay. And here now comes in the issue of boundaries. where then you need to analyze your financial situation and see how much do you as an individual working, how much money do you need, including to save. Then how much can you actually afford to share? And what you can share is then what you let your dependents know, this is how much I can share, or this is how much I can afford. Because then when you put yourself last, you will burn out, you will become resentful, and eventually, life can sometimes just kick you back unfairly, in that you will help your siblings. Yes, they grow and have their own income, and will never come back to say thank you. So the resentment builds. So for me, I'd say put yourself first, decide how much you can actually be able to afford to share that which you can afford, not giving everything and leaving yourself with nothing. So for me, my parting shot would be it would be prioritizing your mental health. I know, as I've heard, that pharmacists are very busy, but giving yourself 10 minutes here and there in a day is not too much to ask for yourself. So much as is that very busy schedule, it's good to give yourself some time every day. Say maybe in a day you have an hour to yourself, whether you distribute it as 10 minutes every other hour, or decide that it will be a whole hour to yourself. If it means waking up earlier, so be it. If it means sleeping later so that you can have some time to yourself, just find a way to at least do something that makes your mental health better and eventually your physical health, because at the end of the day, you need your mental health to be in a good state. As we are seeing, when we don't manage our stress well, then we are predisposing ourselves even to conditions like dementia later in life, which have very negative effects on the quality of life. So at the end of the day, invest in yourself, spend some time to take care of yourself. Yeah, I think that's it. Thank you.
All right. Thank you so much, Dr. Catherine, for that insightful presentation. I think we've all been able to learn something from the presentation. So I see we're already running out of time. So just before we close, I'd like to just share a couple of things. Then thereafter, I'll welcome Dr. Anis to give their closing remarks. So the first one is just to let you know that the Family Fun Day is coming soon again. And this time round, it will be after the World Pharmacist Day. And for this activity, we'll have a couple of things that will be happening. It will be also a farewell for the current PSK leadership. As you know, that we have the elections coming up in October. We'll be having a lot of sporting activities just to work and learn from each other. So kindly save the date. It's going to be on 29th of September, which is on Sunday, from 8 a.m. to 7 p.m. at Sikh Union, Tuangari Madai plants. And for those who would like to have a t-shirt, kindly ensure that you register early. We have a deadline of 14th September because we need to have all the t-shirts printed in advance. So thereafter, we'll not be able to have any done. So kindly just make sure that you book in advance. Also a reminder, yesterday was International Self-Care Day, and this entire period between June month, on 24th of June to 24th of July, we've had the self-care month, and the theme was self-care is healthcare. So in our workspaces, let's advocate for self-care. Then finally, I'll just talk about the upcoming conference in South Africa. And so far, we have a couple of PSK members who will be going for this conference. So if you're interested, kindly send an email to the CEO of PSK, and their email is ceo@psk.or.ke. If you already made some plans, just let us know so that at least we know who will be part of the delegation to South Africa. And at this point, I'd like to welcome Dr. Anis to just give closing remarks. Dr. Anis, karibu.
Thank you, Ezra. On behalf of PSK, I would like to thank Dr. Catherine and for this really interesting webinar. At one point we had almost 900 people on this call. It is exciting, and it is also a topic that as pharmacists we need to embrace. And I'm hoping that we can have more presentations to do with mental health. Pharmacists, if you have any suggested topics that you would like us to look into, please send an email to PSK, and we will work with our partnership that we have with BMI, the Brain and Mind Institute of the Aga Khan University, to help us formulate these kind of strategies together. To Troika, I say thank you very much. This is one of the first webinars where we have had so much interest in the product. So I hope you'll reap benefit and sponsor more and more of such events. So on behalf of PSK, I say thank you to Troika, thank you to Catherine, and thank you to all the pharmacists who have joined. And we look forward to seeing you all at the Family Fun Day. Have a good night, and let's not have insomnia tonight.
All right. Thank you so much, everyone, and have a good night.